ahead and right there. And before we dive into the content for today, I'd like to set the tone for today's meeting. This is definitely going to be something that fosters a lot of bi-directional communication. We want to encourage everyone to ask a lot of questions. And so just to make sure we're setting the ambience, I'd love to ask everyone to update their Zoom names by going to their participant settings and just changing their names. And if you also want to add your pronouns or the organization that you're joining us from, that would also be fantastic. Number two, I'd love to invite everyone to participate in an icebreaker. If you could just use the chat to share 3 words that describe how you're feeling right now, that would be fantastic. Like I said, really setting the tone for this dynamic session we're going to have. And lastly, just as I referenced just a moment ago, please feel more than free to use the chat. We are so lucky to have project partners and plan partners on this call with us today. We're going to cover a lot of curriculum. And so I just want to make sure that everyone feels comfortable asking questions, whether we are or outside of that Q&A, so that way we can make sure we follow up with everyone's needs and we get to, the points that you really want to highlight. All right. And so for today's agenda, I already covered our housekeeping goals to make sure that we're fostering that bidirectional communication. First, I'm going to cover a program overview and describe some resources that we have available for the participants that are on this call today. For some of you that did not attend the statewide session and are just joining us for the first time within the CalAIM Links program, we want to make sure that you have access to our website and that you know precisely what our goals of this project are and what led up to this moment. Number two, we're going to discuss the pathways to becoming a credentialed provider. The plans that we have available in Kings and Tulare counties are HealthNet and Anthem, and we have representatives from both of those plans available, and we're going to walk through that credentialing process in addition to what the DHCS requirements are to make sure that you have the capacity and ability to move forward with meeting those requirements. Because there is a lot of information in that section, we're going to make sure that we pause to have a Q&A to respond to all of your questions. Then we'll move into some bonus material if we have time to cover quarterly reporting, and then we'll close out with another Q&A to make sure, once again, we're processing all of the information and questions that you all have. All right, so for today's objectives, by the end of this session, participants will be able to understand the goals of this project and the resources that we have available for you on the CalAIM Links website. I'll be able to screen share a clip of that website so I can let you know exactly what the tabs are and how you would be able to use each one of those tabs. Second, we'll discuss contracting pathways. CBOs have multiple pathways to be able to enter into a relationship with an MCP. And so before we go into those contracting requirements, we want to actually give you a high-level understanding of what those pathways are. And then lastly, we'll discuss those contracting requirements. Just as I mentioned, those contracting requirements are going to pertain to service delivery, oversight, and data sharing. All right, so diving right into our program for today, I want to start off with our project overview. All right, so I would like to extend a very special thank you to our project partners. CalAIM Links is a collaboration of HealthBegins as the project lead, and we're greatly supported by Aurrera Health Group and Transform Health, and we're being generously funded by the California Healthcare Foundation. Carolina Hansen is our senior program officer, and she provides an incredible amount of investment, time, and collaboration to move this work forward. She is on the line with us today, and I just wanted to extend a very special thank you to all of the effort that she puts into this work and for all of the collaboration that she's fostering, with CBOs and MCPs that are part of this work. And just as I mentioned, I wanted to provide a little bit of background as to what led to this moment, why this work is so important, and what the foundation of our project is. So at a high level, we all understand that CalAIM is transforming Medi-Cal by providing more equitable and coordinated services. One of the goals of CalAIM is to improve quality outcomes and to reduce health disparities among Medi-Cal beneficiaries. And this provides an amazing opportunity for CBOs and MCPs to work together to realize that problem. But one of the things that we realized was that CBOs that are smaller, particularly those that are BIPOC plus led or serving, or those that employ a community-based workforce, they're going to encounter challenges when they are seeking out those contracts. That's resulting from them not having existing relationships due to landscape infrastructure problems, and just essentially the infrastructure not being set up in a way that previously promoted that relationship development and collaboration. And so because we understand that a strong equity-oriented partnership between CBOs and between plans, is what's needed as a part of a critical component to the success of CalAIM and to improve those quality outcomes, we designed an intervention with funding from CHCF to make sure that we were advancing those relationships and preparing CBOs for contracting readiness through this provision of TA. So during our previous phase of work, we were able to hold 9 sessions in 2021. 2 of those were statewide sessions, 2 were regional, and 4 were county specific. The counties that we previously worked in were San Joaquin, Stanislaus, Shasta, and Sonoma. We worked with 3 plans to execute that work. Those plans included HealthNet, Partnership Health Plan, the Health Plan of San Joaquin, and the Health Plan of San Joaquin. And we had 769 participants that partook in that program. And so one of the main takeaways that we realized as one of the outcomes of that work was that CBOs were going to need continued guidance, continued resources, and continued TA to move towards contracting readiness. And because of that need, we were able to get refunded by CHCF to continue this work and improve and enhance this intervention. And so just to outline what the goals for this project are, we want to make sure that we're recruiting CBOs that are led by and or serve communities that have been historically marginalized by societal policies. We'll focus on in these sessions, identifying needs, building knowledge, elevating barriers to providing community support services, and making sure that we're answering all the questions that you need in order to move forward in contracting readiness. Secondly, we want to make sure that we're strengthening statewide capacity amongst CBOs that provide community supports throughout California. And then finally, one of the reasons why it's so important for the plans to be on the call with us today is because we want to improve and build and expand those relationships by facilitating this local networking session, by making sure that we're fostering community building between CBOs and between the plans, because that's going to be one thing that is imperative to being able to realize the promise of CalAIM. All right, and so that's a little bit about the background of the project. And what I would like to share now is what our project approach is going to be in 2022 and why you're here in this session. So as I previously mentioned, we were able to host those prior sessions with Shasta, Sonoma, Stanislaus, and San Joaquin. We were also able to add Trinity, Fresno, Kings, and Tulare to our project approach for 2022. For each one of these groupings, we're going to be able to host 3 sessions, of which you're participating in the first today, and we'll be able to use the lessons learned from this session and your feedback and the takeaways, the questions asked, the surveys completed to be able to frame out the next 2 sessions. And as I mentioned previously, we have HealthNet and Anthem on the line for these specific calls because those are the plans in this county, in these counties, but we're also partnering with Partnership Health Plan and the Health Plan of San Joaquin and other areas in California. This is going to be the second track of this program. For those that attended the statewide session, you understand that that is the foundational universal information that we're sharing with CBOs. Those CS providers are brand new to CalAIM and really need that foundational information. And so we wanted to make sure that everyone would be able to participate in a track that closely related to what their specific needs were and where they are in their contracting readiness. So this track number 1, those statewide foundational tracks are for those CBOs that are brand new to this process. And these county specific sessions will actually include the plans on the call to answer deeper, more specific questions. And then lastly, we did want to make sure that we kept these sessions very intimate by only having approximately 8 to 10 CBOs per session. So we can make sure that we encourage that collaboration and that discussion and networking that would take place in the sessions. All right, so going on to the CalAIM website that I referenced earlier, I would love for everyone when they have a moment to visit healthbegins.org/CalAIM. And what you can see right here on my screen is a screenshot of the website. And what I wanted to let everyone know is how to use this website. So number one, because I know everyone wants to keep up with the sessions that are being hosted, particularly with those that are specific to their counties, the upcoming events tab is going to have everything that you need to get registered for those sessions. And this is going to be updated on a weekly basis. So by tomorrow, you'll be able to see all of the upcoming sessions for Kings and Tulare, and then other counties will see those sessions for Fresno, Stanislaus, San Joaquin, and the statewide sessions as well. In the session archive, we're going to post all of the previously hosted sessions. So that way, if there's content that doesn't exactly make sense today, or you hadn't had the opportunity to attend the statewide session, we'll always have that content available for you. So you can just go to that tab and look at all of those prior events. And then I also wanted to provide you with an update on our project updates tab. This is a tab that's still being built out right now. And what's super important and super amazing about this tab is you're going to not only be able to see all of the session archives and the content and the training supplements that are developed from CalAIM links, but you'll also have those references to DHCS webinars, to HealthNet webinars, to Anthem trainings, because what we want to make sure is that you have a one-stop shop for all of the resources that you need to be successful. What we learned from the last phase of work was that CalAIM is confusing. And so for a lot of the providers that had so many different questions about where do I go for this? Does this pertain to my county? And where can I find resources on this? Where are the most recent DHCS updates? We're going to make sure that we have all of that information on the CalAIM Links website. So that way you can have one place to go for all of those resources. And so speaking of that upcoming sessions tab, the sessions that you're going to see posted by tomorrow are going to be sessions number 2 and 3 for this specific cohort. Those are going to take place on August 24th and November 10th. Today, we're going to focus on, those that want to become community supports providers. You're still making that decision. You're figuring out what CalAIM is, but you have a high enough understanding to participate in an advanced session in lieu of the statewide session. We're going to discuss those contracting considerations and those pathways to becoming a community supports provider. During the next session, we're really going to encourage CBOs to have their finance teams available, because we want to talk about the steps leading up to contracting and the financial and reporting implications and requirements. And then during that last session, we want to talk about what to expect during implementation. And that's another session that finance team should also be available for. And so lastly, before we dive into a few polls, with all of that being said, and you having a complete understanding of the program's goals and objectives, we do have some assumptions about the audience that's participating with us today. So number one, you would definitely be a California-based nonprofit that is located in Kings or Tulare or provides services in one of those counties. Number two, you have an interest in pursuing a community supports contract with Anthem or HealthNet. We do understand that there are some providers that would go the ECM route. These specific trainings are tailored to community supports. Number three, you've been able to review the information session and the Community Supports 201 training supplement that was provided to you. As I mentioned, there are a lot of CBOs that are on vastly different spectrums of, contracting readiness. And so we wanted to make sure that no one felt left out of this process. So I have sent out that information session. We do have statewide information available in that session archive. And I also provided a Community Supports 201 training supplement that would serve as a prerequisite to this specific training. If for any reason you do have questions about that supplement, that is absolutely fine. We would also be willing to answer those questions today as well. And then lastly, you've also completed the CBO readiness assessment, which would take about 15 minutes to complete. And what's really important about this assessment is it lets us know where CBOs in your region are. This, I can't explain how important this assessment is, because with the questions being specifically catered to contracting readiness, that would let us know how to frame the curriculum. And we don't want to frame the curriculum based off of assumptions. We want to hear from the CBOs directly. We want to know exactly what your needs are. And there's no better way than to actually hear it directly from the communities themselves. And so those are our assumptions about the participants of today's session. And so what we'll do now is dive into our first poll question before we start examining the pathways to becoming a community supports provider. And so Our first question is going to be, how far along are you in the CalAIM Community Supports contracting process with an MCP? And you are going to see that poll launch on your screen right now, and we'll give everyone 30 seconds to go ahead and submit a response. All right, so we have a nice mix of responses right now. So we have about 13% that have not decided whether or not they want to pursue, 13% that are just now engaging in conversations with the plan, 13% that are reviewing contracts, and surprisingly, 50% that are already contracted with an MCP. And so based off of some of the emails that I've been communicating back and forth with you all, I see that some CBOs are in contract with one plan and want to pursue a contract with another. And some have contracted with both and are willing to share those best practices that we're able to move them forward in that process. And all right, so we have another poll. And give me 1 second to go ahead and launch that one. All right, and so, sorry about that. So the next poll is going to be for everyone to please review the list of historically marginalized populations or underserved communities below. Which of these populations represent at least 20% of the individuals or organizations served in 2021? And please feel more than free to check all that apply. And give me just 1 second to go ahead and launch that poll. All right, so we have a very diverse mix of populations that are being served by this cohort, and that's really amazing to see. And so based off of the results that you can see on your screen, you see definitely about 90% are Medi-Cal eligible children and adults. We have BIPOC plus communities being served, individuals with disabilities, LGBTQIA plus communities being served, those with disabilities, individuals experiencing homelessness. There is definitely a wide variety of providers that are on this call, which is amazing because that provides for a more diverse conversation and can also, just encourage collaboration between the cohort, or between the CBOs that are participating. All right, and so we can definitely move forward to our next section, which is going to be pathways to becoming a provider. And like I noted, we're going to have a Q&A directly after this section. So please feel more than free to make sure that the questions that you ask encompass what's being covered here and what was covered during our program overview. All right, and so before we dive into that content, I did want to let everyone know that we do have representatives from Anthem and HealthNet that are on the line. We have Leslie Bedeau, who is a Program Manager 3 over Medi-Cal Operations from HealthNet, and we also have Selena Escobar, who is the Senior Director of Medicaid Programs at Anthem. And so I also wanted to let everyone know that we'll post a link to this slide deck, so that way you'll have their email addresses as well. And this deck is going to be uploaded to the CalAIM Links website. And so Leslie, I'd like to open it up to you to provide a brief intro before we dive into the content that will be covered in this section.
Hi, my name is Leslie Bedeau, and as Alexis said, I'm a program manager with HealthNet. I am in Tulare County, and I do know we have some multi-county providers on the line, so also serving in Kern, Stanislaus, and San Joaquin counties. So these same methodologies that we're applying here on the pathway to become a provider. We'll work in the other counties as well. So happy to see you guys all on the call.
Thank you so much, Leslie. And we also have Selena Escobar, and I would love to invite Selena to unmute to introduce herself. And thank you so much again for joining us, Selena.
Good afternoon. Are you able to hear me, Alexis?
Yes, we can. Thank you.
Okay, awesome. Let me move my camera down a little bit. Hi, thank you. I'm a program director with Anthem Blue Cross, our special programs team, helping to ensure that our ECM and community supports programs are up and operational. And just as Leslie mentioned, super excited that you are all here. I recognize lots of names on the call, so look forward to working with you. Thank you.
Thank you so much, Selena. We really appreciate it. And so as we referenced, we will have this deck available for everyone. So that way, if you do have questions, you do know who you can reach out to for those questions as you're moving through the credentialing process, on through the next 2 TA sessions as well. And so the first thing that we wanted to touch point on as we discuss, what the pathway to becoming a provider is what is the role of a community supports provider? And so we kind of wanted to look at this as somewhat of a formula, a 3-point formula that we've, written out here. So that way we can have a well-rounded understanding of what that specifically encompasses. So number one, the role of the CBO is to contract with MCPs or another contracting entity, which we'll discuss on the upcoming slides. As the primary entity that will be responsible for providing those community supports services. Most importantly to recognize is that those CBOs are going to be providing services that are medically appropriate alternatives, hence the former name, in lieu of services, meaning that those providers would not be able to bill for multiple or reciprocal services. It would definitely be alternatives. So like I said, number one, the first role of the MCP is the CBO is to contract with the MCP. Number two, that provider is going to deliver critical medical and social services. Those services include housing navigation, recuperative care, MTM, medically tailored meals, or community transitions. And the entire list of community supports that are available were listed in that Community Supports 201 supplement that we provided to all of the invitees. So if you wanted an entire list of those, you would definitely be able to have that in that supplement. And so these are services that are not typically funded by Medi-Cal, which is the beauty of CalAIM and being able to expand the services and therefore expand the reach that we can give to Medi-Cal beneficiaries. Lastly, these CBOs need to meet the contracting and reporting requirements. And so we're going to touch base on those DHCS requirements during this session, and then we'll dive deeper into reporting requirements in subsequent sessions. And so these contracting requirements pertain to models of care, billing, data sharing, outcome tracking, so on and so forth. And we'll do a comprehensive deep dive into what DHCS's expectations are for those providers in this session. And we'll have deeper relevant information in subsequent sessions to come. All right, and so as we mentioned, there is more than just one way to contract with an MCP. And so the traditional option is definitely going to be for that CBO to go through the credentialing process directly with the plans that we have on the call. So with Anthem or with HealthNet by submitting your LOI, going through credentialing, going through the gap filling process, and then moving towards contracting, where there is also a second option in which those CBOs would be able to contract with a contracting entity. What's good about this is that that would reduce some of the administrative burden that comes with CBOs that are of a lower capacity. Being of a lower capacity does not mean that you should not be able to partake in the CalAIM process, because as we know, the goal is to make sure that we're helping those beneficiaries. And so we'll also outline what that process looks like. And during that section, I'll also see if there are any intermediaries or contracting entities that are on the call with us today. That would be great if we could uplift those entities as well. All right, and so moving on to contracting option number one. So in most cases, the managed care plan is going to contract directly with that community supports provider. As I just referenced, you going through that LOI process, working your way through credentialing, fulfilling that gap filling process, and then closing that contract with that provider based on the community supports that your organization can render. That MCP is going to have certain criteria that the CBO has to fulfill. And something that's also important to uplift about that is these are not just requirements that are being rendered by the MCP. DHCS has provided very specific guidance that the CBOs have to meet to make sure that they have the capacity to, conduct outreach, to fulfill those referrals, to make sure that they have the processes and systems in place to be able to meet the needs of the population that that provider would be serving. Some of those criteria include ability to meet service delivery criteria, which we're going to discuss today, capacity, data sharing infrastructure, their ability to bill, ability to meet reporting requirements, so on and so forth. And so we're going to touch base on 3 of those requirements during this session. And then the MCPs are going to have a process for demonstrating readiness for contracting, for those community supports providers. And we're also going to touch base on what that process looks like as well. So contracting option number 1 is directly contracting with an MCP. We're going to discuss those DHS requirements in the subsequent section. We also have option number 2, which is what we discussed, being able to go through a contracting entity. So a contracting entity can be an FQHC, it can be a county agency, and as referenced, it's something that can reduce the administrative burden of that CBO because they may not have as much capacity, as a larger organization, but that does not mean that they need to be excluded from this process. And so this is a less common option, but it is something that exists, and that contracting entities such as that county agency would serve essentially as an administrative hub. The CBO would still need to meet, those DHCS requirements. And sometimes these relationships stem from things that are pre-existing, such as, an entity's relationship that was developed under the whole person care pilot. And so in those specific cases, that CS provider would be a subcontractor of that county agency or of that contracting entity. Like I said, they still need to meet all of those service requirements, but the county or contracting entity can take on certain administrative functions. Those functions could include data sharing, reporting, invoicing, so on and so forth. And so now that we understand what those 2 pathways are, the more common process is definitely going to be going directly through that MCP. And so for Anthem, these county specific sessions are tailored to, the plans that are relative to your counties. And so for Anthem, their process is a 4-step process that we'll outline right here. Number 1, you would need to visit their website. We do have this link available inside of this deck to submit a letter of interest. After you receive or submit that LOI, Anthem would then contact the CBO to then partake in the certification application process. After the certification application is received, the plan would then work with you to be able to close any gaps that were unveiled during that application process. So if there's something that's not meeting the DHCS requirements, they would work with you to make sure that they can move you towards being able to contract. But once again, what's most important to share is that the CBO needs to display an ability to meet those DHCS requirements in order for that credentialing process to be completed. And so after that gap closure process is concluded, then that entity would be able to work towards contracting. That CBO would be able to move towards contracting. And if you click on that link, that is going to take you to that Anthem letter of interest form. And it's going to ask you a number of questions about your organization. And as noted, after you submit this, you would then receive that certification application directly from Anthem, and they'll be able to walk you through the gap closure process. And once again, the DHS requirements that are required of those CBOs to meet are going to be outlined in this presentation today. And so for HealthNet, there is a very slightly different process, ever so slightly. So the first thing you would need to do is obtain your MPI. We've also included the link to receive that MPI here or submit for that MPI. We've heard back from CBOs in the past that that has never been a hurdle. That's something that has been very easy. There's a fast turnaround. So if you click on this link, submit that information about your CBO, you would be able to move forward with submitting for your MPI. after you have that MPI, you would then go ahead and submit your letter of interest to HealthNet. After that letter of interest is submitted using the link that we provided in this deck, you would then be able to move forward in their certification application process. In addition to that application, it's also going to include a review of W-9, your COI, which is your certificate of insurance, and it's also going to examine your claim and referral abilities. And here is a snapshot of what that application looks like. I do want to give everyone a heads up that it looks daunting when you open the application. However, that's only because you only need to submit criteria and narrative responses for the community supports that your organization has experience with rendering. So each application is going to have the sections for all community supports. So that's what makes it look daunting. So I'm just letting everyone do not get overwhelmed. You only need to complete the sections that are specific to the community supports that you have experience with rendering. And so when you submit for your MPI, you submit your letter of interest, and you now, receive that certification application. I just want to do a very brief overview of what you need to complete in that application. So number one, as I referenced earlier, the certification process ensures that community supports providers can meet the DHCS requirements that we're going to discuss in the next section of this specific training. Number two, there's going to be a provider information section. All CBOs are required to complete that section, no matter the CS services that you'll be providing. It's just a very general information section. Number three, you'll complete the general provider section. Once again, very general. This is going to come in directly after that provider information section. And number four, like I referenced previously, you're going to see all of the sections for all community support services that DHCS is offering right now, but you only need to complete the sections that are specific to your organization, just the sections that your organization can offer. So there are narrative form boxes that allow you to respond, and it's going to ask you about the DHS requirements that we're going to outline in this next section. And once again, the most important thing to display and validate on those forms is that your organization can meet those DHCS requirements. All right, so I know that was a lot of information to process pertaining to the CalAIM Links project itself, the program objectives, how you can use the CalAIM Links website, pathways to becoming a provider, the credentialing process. And so I wanted to stop and encourage, some questions. I know that there were questions or poll responses that showed that some individuals were still deciding if they wanted to be a provider. Some were, entering the contracting process. Some CBOs have already contracted, and so we would love to uplift those best practices as well. And so, yes, we would love to hear any questions that anyone has.
Alexis, this is Leslie with HealthNet. One thing I also wanted to point out in Tulare County is that if you are already credentialed or completed a certification application with ourselves or with Anthem, we don't expect that you need to complete that twice. We have been sharing applications as long as you just reach out to us and say, hey, Leslie, do you mind sharing my application over with Anthem? That way we can just kind of ease the burden of completing multiple applications in the counties and hopefully make your job a little bit easier.
Thank you so much for sharing that, Leslie. I really appreciate it. Because once again, I know that's something that is daunting for some of the providers is, the administrative burden, especially for those smaller organizations. So that's something really good for us to all know. And like I said, we would definitely love to uplift any questions that anyone has, particularly for those CBOs that are like brand new to this process and may have participated in the statewide session, just now, being integrated into these county specific sessions, questions pertaining to contracting, the process, these pathways, so on and so forth. And something else I did want to ask is, do we have any county agencies or county departments that are on the call today as well? I'm looking through the attendees right now, and I am not sure if we do. Oh, there we go. All right, I see someone that is here from Tulare County. And so one question that I do have for you is, Shannon, I'm not sure, like, does your agency know if you all are looking forward or towards being a subcontract or subcontracting CBOs as well? Is that something that you've considered, something that you're looking forward to implementing?
I hope I can just unmute and talk. I didn't know if I could or not, but so for community supports in Tulare County, we are still very much in the wait and see category. We were one of the ones that said, like, we're thinking about it, or we're still not sure. So I'm really more here just to kind of get an idea of what maybe if there's other things that, you know, in Tulare County, do we need to support somebody on? So we're not currently actively working towards becoming a contractor for community supports, but there are a couple that we may be interested in the next year or so.
And that is really good for us to hear, Shannon, and very reflective of, you know, what we've also heard in the landscape. You know, as DHCS continues to have community supports roll out, there are going to be a lot more CBOs and agencies and entities that move towards, you know, the contracting process. And so I'm really glad to hear that we do have, you know, yet another, you know, participant that is at a varying level of, you know, entering into this process, because we do hope that the information shared today can help to inform, you know, what your decision is in the contracting process. Do you want to move forward? And then even more so, like, would you serve as a, you know, a contracting entity? So I appreciate that feedback. And so, yeah, before we move on to the next section to discuss the DHCS requirements, you know, for contracting, you know, and those requirements that the plans would be assessing during that credentialing process. Do we have any other questions about the program itself or about those contracting pathways? All right. I will definitely turn it over to Sadhna Devaraja, who is the Managing Director of HealthBegins, and she is going to cover the DHCS contracting requirements.
Thank you, Alexis, and thank you for this amazing amount of information that you shared with folks. I know there are a bunch of links that we'll be sharing in the chat as we go along through the rest of this session. And before we do that, I am hoping we could do a quick poll to see from the CBOs that are in the room, what types of community services, community support services does your CBO have experience in providing, or are you interested in applying for? And we've listed the community supports up here on the poll. And so Alexis, if you could start that timer. We can give folks side. And if you think there's like a community support service that you thought would be here and isn't here, or if there's a trend that you're not sure about, please feel free to jump in and add those in chat. We can talk about that. I can see the results here. It looks like the majority of folks are involved in housing transition, navigation services, or in housing deposits, housing tenancies. This is really what we've seen across the state as well. There are a number of CBOs that are interested in the housing related community support. So it's great to see that here. And we see good distribution though across all of the community supports beyond that. So really great to have that diversity here, and we'll kind of try to speak to to all of them at once. So if we go to this section, so what we're talking about, we just talked about the certification process, and Alexis really nicely laid out that that's the process for certification, and we have those links available for folks. But what are we certifying, right? Like, what are we trying to get certified? And so when we look at the role of community supports, we need to, as Alexis laid out previously, contract with MCPs, as our first kind of responsibility, and then be able to deliver and meet the contracting and service requirements. And by going through the certification process, that's kind of the first step of deciding, can this organization live up to that role and responsibility? And one thing that I want to make clear is that community supports are optional for MCPs to offer and for members to utilize, But if a managed care plan offers a community support, then the state DHCS places requirements on what and how they'll be covered. So it's kind of like if you don't have to drive when you turn 16, but if you do, then you need a license and insurance and follow the rules of the road. And so I think one thing that's good to ask while you're going through this process with your health plan partners is, is this a requirement of the state? So that you're really clear on what you need to really meet to be able to get the contract and where there might be discretion. And the things that we'll be covering here are things that are required by the state in order to contract. And so if we go to the next slide, we can get to kind of the overview of what some of these standard terms and conditions are and what these standard requirements are. Another thing I wanted to say, because as I was going through those links from both HealthNet and from Anthem, and Alexis mentioned this earlier, community supports used to be called in lieu of services. So you'll see that language used interchangeably, both in like state documents, sometimes in plan documents. And so just being really clear that community supports, ILOS, in lieu of services, those are all kind of being used, and community supports is the term that's being used now. But you may see documents and things being shared today that reference ILOS as well. So here are the 4 kind of main categories of core requirements that must be met in order to contract with an MCP. And today, what I'll go through first are the provider's ability to meet service delivery criteria. And so if when you get this deck, you'll see this all laid out in DHCS standard terms and conditions. And I think we can actually put it in the chat now for folks to just see what that looks like. You give me a second,
I can add it to the chat.
Okay, that's great. And I think it's helpful to open that up just so you know what it looks like. This deck is very beautiful and the policy documents are a little less so. And so just so you can map to it, one thing I want to mention about that document is that it includes ECM and also community supports. And that first part of the document is on ECM. So if you're interested in community supports, which is why you're here, scroll to page 12 to get access to the information that we'll be covering. So if you go to the next slide, we will start with some of the service delivery criteria. And so the service definitions are really what we just pulled on, right? There are essentially 14 of them. You may know them already. Actually, I'm going to pause for a second and see if folks in chat or otherwise can like raise your hand or unmute and say, were any of those service definition or any of the services unfamiliar to folks? Did people have a hard time choosing services? And thanks for putting that in chat, Lucy. I don't hear anyone kind of coming off mute or chatting on that point. So I'm going to assume that folks are familiar with the terms and that they chose based on familiarity of seeing those terms before and that experience. There's the DHCS policy guide. Thanks for that, Lucy. That will define the services in detail. And if you look on page 7 of the policy guide, you can start seeing those definitions in more detail. So one of our first assignments for you, and there'll be a few through this section, is to review those service definitions in that policy guide link and make sure that when you're thinking about the services that you offer and kind of moving forward with providing a community support, that it's matching up with the definitions that's provided by DHCS's policy guide. And then if there's not, especially in the housing spaces, there may be like 14 requirements, 14 pieces of service that you should be delivering within the housing supports space and the housing transition navigation service support space. And so making sure that you can click all of those boxes. And if not, think through, are there changes that need to be made to your policies or procedures to be in accordance? Are there subcontracts that need to be pursued to be able to meet all of these needs? Kind of what could be some of the gaps to meeting those needs? I would say that based on conversations that I've had with plans across the state, that not being able to meet all of those isn't an immediate no, but it's kind of a way to figure out what needs to be problem solved to be able to get you into contract. So that assignment is the first one, to review that policy guide, make sure your definitions are matching up with what DHCS's definitions are for these services, and seeing what kind of needs to be filled in if they're not already. And then there's staffing as a second piece of the delivery criteria. So people need to, community-based organizations need to maintain staffing that allows for timely, high-quality service delivery of the community supports that's contracted to provide. And there are some like additional features of what that means, of what timely, high-quality service means. But there's an assignment here to be able to think about what that means for your CBO. Is that already part of your staffing procedure, or is that something that needs to be augmented? And then there's data sharing. This is a huge kind of component that's being really summarized in a small way here, but there's a lot around data sharing and obligations that are required for CBOs to be able to maintain. I know that plans have HIPAA trainings available as part of their offerings, and Lucy just put into the chat the data sharing guidance. And so the assignment here is to review those, right? To be able to examine whether your data systems are able to store, protect, and share protected health information. And again, I would just reiterate that if it is currently not, there's still pathways that can be built to get us there. And so to not necessarily count yourself out if that's not where your organization is at this point, but to just be able to map out, well, these are the things that we need to meet and think through and I would say with the plans, possibly with each other TA providers, on how we can build that ramp to get to those data sharing requirements. We go to the next slide. Other aspects of the criteria are referrals. And so many of you may already have referrals in place, and the language here is to accept and act upon referrals from managed care plans. And what we'll ask folks here to do is to examine how these referrals are being made and accepted. You're probably accepting referrals, if not from a managed care plan, from other entities. Kind of examine what your referral processes are right now. We are planning to talk about this more in session 2, related to how the plans are using referral processes. But for your CBO, think about as you go into session 2, how are referrals being made and accepted, and then what might need to be put into place. And of course, after session 2, you may have more kind of ideas about what needs to be put in place when you hear from the plans. Outreach practices. So are you able to outreach to referrals as soon as possible, and certainly within 24 hours? Is that going to be a stretch for your organization? And think through what processes exist there, and relatedly responsiveness. I think these two kind of go together. So it's not just responding to the referral, but being responsive to calls, having voicemail set up, being able to have that infrastructure in place to be able to really connect in a high quality, timely way to any referrals that are coming in. If we go to the next slide, you'll see some of these other criteria. I imagine that a number of these are ones that CBOs can meet or have met, right? Like cultural competency, non-discrimination, transition planning. These might already be things that your organization has thought of. I will say that in conversations that I've had with CBOs, it's not necessarily that they're not doing these things. It's, is it documented? Are they in policies and procedures? Are you able to provide training schedules on them? And are you able to kind of support that this is the work that you're doing? And so thinking through how you're able to represent that these criteria are being met at your organization will be important as you enter into contracting conversations. I want to pause there for a second and see if there's anything on the criteria that I kind of went through too quickly, or if there was something on screen in just those last 3 service delivery criteria that folks want a little bit more about. I know we'll have a Q&A pause at the end of this, but I'm going to go ahead, and thanks, Alexis, for putting in the 201 supplement as well. I know that that would be really helpful for any foundational information that maybe is being shorthanded here, if folks want to refer to that beforehand. So then there's also, quality and oversight requirements and the data sharing requirements, as I mentioned earlier. So what a community support provider will need to do is understand and acknowledge that the plan is going to conduct oversight of its delivery. And so there's going to be reporting involved with this. There's this necessary kind of need to ensure that the quality is in compliance with a lot of the obligations that the plan and the community supports provider have. And so just being aware of the reporting, the audits, that there might be corrective actions that are involved in this process is important to know. And so each plan may have, there's going to be some reporting that is required, and there might be other reporting that is plan specific. And so after TA session 2, where we'll go into this in a little bit more detail, especially when you'll have also your finance team with you, we can talk about, what you'll need to research on, like what reporting is required by the plan. And based on these reporting requirements, to think about, does your organization have that bandwidth and ability to generate the needed reports? And so we'll talk about this a little bit more in TA session 2, especially as you have maybe additional members of your team, but want to lay this out because it does show up in some of the credentialing. And then the next slide on data sharing is, as part of the process, the community supports provider will have access to sensitive information. And we want you to examine what systems your CBO has in place to receive any demographic and administrative information relating to eligibility. And so that's kind of the last piece of the criteria assignment for today, is to think about, does your CBO have kind of the bandwidth and the ability to receive this type of information? And Lucy also linked the data sharing document, kind of review that and make sure that you're able to effectively provide the requested service. And so I think those are all of the pieces of data sharing. And I'm going to go to the Q&A to see if I want to kind of ask a question to see if folks, because I'm not sure if this is going too in depth or if it's not enough. So I want to know if from anyone to see if folks have kind of gone through this credentialing process. It sounded like at the top that there may have been, some folks that have already contracted, so they might have already done a credentialing process. I want to hear from them if there's any kind of color that they would add to that process so far. I also actually, welcome Leslie or Selena to chime in on the criteria and see if there's any reflections that you would share on your experience with CBOs navigating that criteria.
The one thing I would like to share is there are times for smaller CBOs that maybe have not worked with Medi-Cal in the past to feel a little intimidated by the process. And we definitely do not want you to feel intimidated by this process. We are here to support you every step of the way. HealthBegins is here to help support you guys. We want to make sure that you're comfortable with the process. I know from my end, just working through some applications with people, helping kind of understand what we're looking for or what DHCS is looking for in their requirements, and making sure I've even helped provide, some of the verbiage on that. We just really want to make sure this is an easy process for you guys. And we never want you to feel, we don't want the administrative piece to be a prohibitive barrier for you. We definitely want you guys to apply, and we will get you through the process. We're just here to support.
I love that. Thanks, Leslie. Selena, I saw you
I
go.
10,000% agree with Leslie. Very well said, Leslie. Absolutely. So at Anthem, we have developed specialized teams to assist providers, whether you are interested in enhanced care management or community supports, or you want to do both, right? So we have our dedicated regional program managers that can assist you. We have our community supports clinical coordination team. So depending on your specific question or need, even myself, you can just shoot me an email and say, hey, Selena, I really don't understand this part of it. I'm happy to help, or I will pull in the folks that that we can meet with you on. Same thing for enhanced care management. We have our practice transformation specialists. They are LCSWs, LMFTs, as well as other types of clinicians, medical clinicians as well. So we're here to support you. It is confusing and complicated for us too, right? So in large parts, we're sort of building the plane as we fly it, or the ship as we're sailing it. And so we're right there with you. And then on the other hand too, if say you're through the contracting process already and you have an opportunity to look back and reflect, you might say, hey, Selena, or hey, Leslie, how about this? Have you all considered this instead? So if you have some feedback for us, maybe you do have some experience in contracting with another type of entity or partnering with another entity, let us know that too. We're open to changing some processes and policies and procedures. We're not necessarily stuck in every set of the ways. So please reach out to us. Thank you, Alexis.
I love that, Selena. Thank you so much to both of you, Leslie and Selena. And I saw, Leslie, you put in your email into the chat, and I know Selena's email was on screen before if you wanted to put that in chat too. And just really appreciate both of you for kind of coming off mute and reinforcing that and encouraging folks to apply. And I saw, Alexis, you put some of the credentialing application information into the chat as well. So folks know that as you click on those links and you look at the information there, the plans have already said that they're working with each other. So if you fill one out and want them to send it to the other plan, that's totally doable. And the second is that as you fill it out, if there are questions coming up for you, both Selena and Leslie are available to help you work through those questions. If you're encountering that you're answering no more than yes, kind of to talk through what that means and how to create a path forward with that. So thank you both. I don't know if anyone has any questions otherwise from looking at these links and hearing Leslie and Selena as well.
And so, Sudden, I'd also like to do a quick temperature check because I see that we do have a quiet audience today. And so I really wanted to get a sense from everyone, just referring back to Sadna's question earlier, where is this content, as it pertains to where you are with your CalAIM, contracting readiness. And so your responses would definitely be like the best gauge and measure for us to know, if this content is being paced properly, because we do have one last section, but if this is something that has already been a lot for our participants to digest, we wouldn't want to throw another section on top of the content that has been, discussed thus far. But if, it is something that everyone was able to process properly, if it has been informative, if the quarterly monitoring section would be beneficial, we would definitely like to hear back from you. How is the content being paced? Is that something that we can move to the subsequent session? I think something that I just want to really uplift and validate is that we definitely want to hear from you, specifically what it is that you need, and we will absolutely cater the content to respond to exactly what your needs are.
And I'm wondering if I could call on folks just kind of to get that gauge. I know a few folks jumped in chat at the beginning. And so if that's okay, Alexis, maybe I'll
Yeah, definitely.
call on Tanisha, because I love that you said you were ready to learn. So I'm curious to see if Tanisha Morris, if you wouldn't mind getting off mute if you're able to, and just kind of reflect on whether this content was stuff maybe you already knew, or if it's possibly in the other end of the continuum of too much.
Good afternoon. I'm here. Yes, the content is stuff that I am already familiar with, but that's because our agency has gone through the contracting process with both of Anthem Managed Care Plan and with HealthNet. But it's I believe that you guys are doing a great job right here. I think that it's all very necessary information, and it's still very helpful. It is confusing and it is very detailed. So I appreciate that you guys are doing this, and that even though I'm familiar with it, it's good to keep reviewing so that it stays fresh. There's one thing that I did want to, I noticed that and the referral process, it seems to me, so we've been contracted with Anthem for CS services for a few months now, and we are done with the contracting process and the application process for HealthNet to begin services. We just started, they just began July. But it seems to me that the referral process is different for both of the managed care plans. And that is something that for me, I feel like I don't know how to put it. It would be really great if they were very much the same, or if they could be similar, or if you guys could be on the same page when it comes to referral. For Anthem, it seems that, referrals are sent to us, but I think if I get it right, HealthNet, we're going to be reaching out and making the referrals for ourselves. And so, and it's just two different platforms. So that part right there is just, coming from the insight of a provider experience, it's a lot for either one or the other. So being with both managed care plans, it being so different in that way is a little bit daunting. I don't know if that'll help anything, but.
Tanisha, thank you so much for that feedback. I will say from the HealthNet perspective, we are hoping that overall the ECM partners and other community partners are leveraging the Find Help application so that they can log in to Find Help. They're able to find your organization for what services you offer, and they're able to send you guys a referral through that platform. The only piece that you guys would be responsible for doing, because HealthNet's not necessarily sending you the referral, we're hoping that the community the ECM member partners are. They're identifying that the patients need these services when they're doing their care plans with them, and you would receive the Find Help referral, and then your responsibility from there would be to get the authorization for those services. And I'm not sure, Selena, if Anthem is also leveraging Find Help as well.
Yeah, we will be leveraging Find Help. So that's one way that, that we can be a little bit more streamlined and consistent. So we, in addition to Find Help, what we're doing currently is, really a no wrong door approach to referrals, right? So referrals can come into us from a variety of ways, whether it's a phone call, an email, the referral form being faxed. And that's why Tanisha will often send them to you, because we are receiving them first, right? From a member, we were surprised on how much a member will call in directly and say, hey, I heard you're offering meals, or I could use some housing support. And so then, from that point, we are then connecting them with you all. But you are also able to, say an individual walks into your organization and you go through your own assessment and determine that, I think this person may be eligible for housing transition or housing tenancy, perhaps. You could then send us a referral. We would go through our review and authorization process and, make sure that they're successfully connected. But yeah, so Find Help is one way that we will, very shortly be on the same page with, as as far as Anthem and HealthNet or Calviva. And then, any other way as well for Anthem. But you're right. I think the best that we can in any county, streamline our processes and be aligned in that way is definitely ideal. So thank you, Tanisha.
Thank you both. I have just a real quick follow-up question. So Selena, do you foresee, that's good to know that you guys are looking into using Find Help as well. Do you foresee sticking with Availity also? Or so it would be Find Help and Availity that you guys would use in the future? And then for Leslie, for you, are you guys looking into also using Availity along with Find Help also?
So we're also taking the no wrong door approach, but I think maybe we're confusing semantics a little bit. So when we speak of just the referral piece itself, we would look at that as maybe your workflow, where how do you know what patients you need to take care of? And what services, Tanisha, if you can help me out, that you guys offer?
We offer the housing navigation, the housing sustaining tenancy, housing deposits with you guys. Okay,
great. So I'm just going to pick on COEA because I see Crystal Ortiz is on the line. So let's just say COEA, they see an ECM patient and they realize this patient needs housing services. They can use Find Help to send you guys a referral. They can call you up and send you the referral. They can fax it to you, whatever means of communication you guys typically utilize. Again, it's that no wrong door approach. So that's what we consider referral, is how those patients are getting sent over to you. But then we do also need you to get authorization for them. And so for the authorization, I believe on Anthem side, they use Availity, and on our side, we use the HealthNet provider portal. So our provider portal is going to remain the same type of provider portal we have now. And if you don't have access to that, my email I did put in the chat, I can shoot you another email and we could walk through that process to make sure you guys do have access. But that would be where you can electronically submit for authorization, and then you should see that authorization come back relatively quickly within our provider portal. Does that help kind of clear up maybe? I just want to make sure we're both talking about the same thing when we're using the right words. Like, I'm not using a different word than you.
Absolutely. It is clear. We are signed up with the HealthNet. There is a lot of different, and that's exactly what I mean. So thank you for just laying that out. And yes, it makes a lot of sense. Thank you very much.
Yeah. So we are using Availity, to go back to your question, Tanisha. Availity is our internal platform as one way to receive referrals. And then it is also through Availity that our clinical team will provide the authorization status as well. But Availity is not the only way that we might receive a referral or even communicate with you of what that referral is, right? So if you don't have access to Availity, or maybe there's some technical issues with Availity, we can communicate to an extent via email as well. But the Find Help is the external platform that we will have in addition to the other methods that are in process already. Was that helpful?
Thank you so much.
Yes, more confusing?
So much.
Okay.
No, that is helpful. Thank you very much. I do think that just the simple fact of being using Availity more, because we've already been contracted with Anthem, and the HealthNet contracting is just barely starting. So the more practice that I get with that we get with the HealthNet, Find Help, and the health provider network, that'll all start making a lot more sense and being easier to use. So thank you.
Yeah, great.
Tanisha, and thank you so much again for uplifting that question. And because you are already contracted with both entities, I did want to take this opportunity to ask, are there any best practices that you would want to uplift, for the providers that are on the line that are not yet contracted?
ask questions, utilize the managed care plans when they say that they will help you. They have a bunch of people a bunch of entities, a bunch of agencies that they are helping. I mean, there's a lot of us, but so they're not going to reach out to you necessarily. I mean, they will reach out to you, but they're not going to necessarily know when you have a question or what question it is. So just don't hesitate to ask, to like email, and when they say go ahead and do that, just take them up on it and ask.
We realize that, for community-based organizations, as Alexis, was sharing earlier, that so much of this is new, right? So when we're bringing our teams on board internally, we are looking out for that in certain qualities and individuals that, have that patience and are, willing to communicate and walk through step by step, because what we might refer to you as it's kind of a non-traditional provider, right? In many instances. So that's what we're here for, is to, to take the time and go through, whatever question you have, and go through the process and explain, what happens next and what happens after that. So absolutely, yeah, Tanisha, you're right. You're spot on. Reach out to us if you have those questions, because although we have for Anthem monthly and sometimes twice a monthly webinars, we have established office hours to support. Sometimes it's easier to just reach out and ping us individually, right? One-on-one, just to get that extra support, because those other methods they can be large group. And so if you prefer, or if a CBO is more comfortable working with us one-on-one, we're happy to do that.
We really appreciate just a level of encouragement, Selena and Leslie, that you both are offering to all of the CBOs that are on the line right now, because I think it's really important for us to identify in this moment that we are seeing CBOs move further along in the process, which is absolutely amazing. And at the same time that we are seeing those CBOs move forward, that we do not want any CBOs to feel like they're left out of this process. For those that are still considering whether or not, they do want to move forward with providing community support services, if they want to engage in contracting with an MCP, this is definitely, the place to ask questions. The contact information is on the screen right now. It is in that deck that was provided in the chat. I'll make sure I email this out to all of the participants so that way they can ask any subsequent follow-up questions that they may have. But what's also very important for us, at HealthBegins with our partners Transform and Aurrera, is to know exactly, what it is that you need help with. So that way we can continue to tailor the curriculum specifically to your needs. And so I did want to, before we go on to some very important next steps with being able to, receive your feedback on that content, I just wanted to have a couple of more slides, and I'll give you all an opportunity to complete a very quick survey that would be able to inform that content. And so based on what you learned from the session today, how likely are you to pursue a contract to become a community supports provider for an MCP in your service area? And this can be for the providers that are just considering contracting, for those that have one but might want another, those that are mid-contracting. Everyone can feel more than free to participate in this poll. And so give me just 1 second to launch it. There we are, and I will start our timer. All right, and then I do want to have one last poll before we move on to our curriculum survey. So we wanted to give everyone an opportunity so that way we can actually process this out loud. What are the topics that you would like to see us present to, move you forward in contracting readiness? And so we have a number of options that are right here on the screen, and I'll also go ahead and launch that poll. And so this is going to be for upcoming topics. And we have about 10 options here. We would love for everyone to pick 3, so that way we could really narrow it down to exactly what this region needs. So that way we can see if there are any trends across CBOs. And so I'll go ahead and launch that right now. And I will go ahead and launch our clock. All right, and so I know that we just concluded a Q&A, and I did want to see if there were any other questions that anyone might have. I know that there are a number of CBOs that have identified that they have already concluded contracting. So even if you have some questions that we might be able to send up to the MCPs pertaining to implementation, please feel more than free to ask those as well, because those might be questions that we also may be able to include in future curriculum, for CBOs that have not yet contracted, what to expect during implementation. And so, besides reporting requirements, county specific questions, sharing best practices, any other questions that we can uplift. And at the same time that we are uplifting these questions, I did want to post a very brief curriculum survey in the chat for everyone right now. And we'll definitely take this time, while we're answering these questions, to be able to complete this survey as well. It'll definitely only take about 2 minutes to complete. And so I am dropping that in the chat for everyone right now. There we go. And so, yeah, please feel more than free to go ahead and take the next few moments to complete that curriculum survey as we discuss any final questions that anyone may have. And I know that this was a pretty quiet audience today. And so if there was anyone that, perhaps had questions that they didn't know were relative to the content or relative to the specific topic that we were covering today, we'd still like to encourage you to uplift those questions just in case it's helpful. And I would also like to welcome Sadhana, Selena, Leslie, any final remarks that you all may have as well, or any questions that you might like to pose to any of the participants. We did want to keep these sessions very small and intimate by only inviting approximately 8 to 10 CBOs. And so we do have 20 individuals on the line right now. And so any final questions that we might want to pose to them before we discuss our next steps?
This is Selena. I know we're in another group setting, right? I just spoke of, and I love that, Alexis, you're pointing out that this is an intimate group, a smaller session, so if you're comfortable, asking or sharing with us a topic, please do. Whether it's in the survey or right now in person, we're happy to help. And, I truly want to hear some feedback on what we can do differently and what we can do better. It is our goal to make sure that you are successful in your program operations, after you get through contracting, and of course during your contracting process as well. So I'm really just truly open to the feedback, and whether it's in this setting or another, please don't hesitate to reach out.
Yeah, Selena, and I would echo those words. We're here to support you. We want to improve the process. You guys all know how it is working with DHCS, that things are always changing and we have to be able to pivot quickly. And so there are times where we pivot, and maybe the process that we have in place is a little, could be considered as a barrier for you. And if that is the case, reach out, let us know, so that we can take those back to our internal teams and see if there's a way we can make the process easier for you guys. So I just thank you guys all for joining and participating, and we look forward to partnering with you guys and seeing what we can do to improve the services that we have to offer in Kings and Tulare counties.
Thank you both so incredibly much. And so we can definitely dive into some next steps, because as I referenced, this is going to be part 1 of a 3-part series within Kings and Tulare counties. And so as our next steps, we will go ahead and skip out on our beautiful music for that survey. I just wanted to remind everyone that I did go ahead and share a link to this content in the chat for you so that you will have access to all of the materials and the hyperlinks that were included in this deck. At the end of this deck, there is a very comprehensive appendix that also includes links to DHCS webinars, DHCS materials. We do have some links specifically pertaining to the plan, so that way you can have the references for the LOI, for the certification process, for community support service definitions, so on and so forth. And so essentially we want to make sure that we have all of this information for you in one place, so that way we can be as helpful as possible. For future sessions, we'll outline funding opportunities, including how to blend and braid funding, reporting requirements, billing and invoicing systems, and more. And so if you have not completed the readiness assessment that I sent out via email, we'll also resend that readiness assessment out in the post-event email. So that way we can make sure that we're collecting very, very, very targeted and specific feedback from you pertaining to where you are on the readiness spectrum, and making sure that we're collecting that information and taking it back to the plans. I also included registration links for our upcoming statewide sessions. So if you are one of those CBOs that is an earlier stage of readiness, please feel more than free to use the CalAIM Links website. Once again, that link was dropped in the chat, so that way you can review those sessions that we recorded in our archive. That includes like very foundational information. So if for any reason, anything that was in today's session was a lot to digest, there's a lot of prerequisite information that is in the archive. And then lastly, the second session for Kings and Tulare is going to take place on August 24th. So about a month and a half away from now. And so we just want to make sure that you have the link to register to that session as well. So if you visit the CalAIM Links website, the registration materials for that session are going to be available either by the end of today or by tomorrow for you to get registered. And then, as noted by Leslie and Selena, we definitely want to make sure that we're answering all of your questions. So if you have any questions for HealthBegins Aurrera Transform specifically, please feel more than free to send those into CalAIM@healthbegins.org. And we will definitely get back to any questions that you may have. Included in this deck, we also included the information for Leslie and Selena multiple times, because we want to make sure that you realize they are very accessible. So if you do have questions, they do want to support you in being able to move forward in contracting readiness, because what's most important to take away from this is that we're trying to make sure that we're supporting Medi-Cal beneficiaries and moving the needle on health equity, and being able to pull those populations into this process by expanding services. And that's what the heart of all of this is about. And so I did want to extend a very special thank you to everyone that participated in this session. All of the questions I received via email. I'm so sorry, did I
I'm sorry, Alexis. I just wanted to mention that Eric has his hand up. And so before you get into
sorry, Eric. The special thanks was for Eric. That's what it was.
I don't know if I deserve that just yet. Thank you, though. I tried to work through the readiness assessment, and it didn't look like the survey was working, at least the version that I clicked on, where, it's a rating scale, like strongly to not so strongly for all the, you could only select one of the rating levels once per area. And so if I responded strongly to any one area more than once, it wouldn't allow. Was that by design, or is that something that...
Thank you so much. So, and that was specifically for the readiness assessment, not the curriculum assessment, correct?
I believe so, yeah.
Perfect. Thank you so much. So what I'll do is I'll definitely look at the back end and see whatever it is that I need to revise or edit, and I'll make sure that I send it right back out to you. I was able to receive some responses. And so if there was anyone else that had that issue, feel more than free to let me know. So that way I can make sure that it's fixed. And Eric, I really appreciate you flagging that, because we want to make sure you can submit it, right? So
yes, I also had that issue. And so I just actually left them blank after the first two.
Perfect. Thank you so much, Nisha. I really appreciate that feedback. So that way I can make sure that I fix that issue and send it right back out to everyone. Thank you so much. Perfect. All right. So once again, we just wanted to thank everyone for joining us today for this session. As noted, we do try to keep them as intimate as possible. So I really do appreciate having a slightly larger audience than we expected. And then just for everyone to know specifically who works on this project team, we have our amazing project team at HealthBegins, which consists of Rishi Manchanda, Sadhna Devaraja, who is on the call with us today, Melissa Meza, who's also on the call with us today, and myself. Our project partners include Gretchen Schroeder and Lisa Chansawan from Transform Health. And then we also receive a lot of support from Aurrera Health, which consists of Lucy Pagel, Jill Donnelly, Jessica Layden, and Kathleen Kane. And our independent evaluator that's on the call with us today is Beth Siegel from Mount Auburn Associates. And so just as a reminder, all of the resources for this session are going to be uploaded to the CalAIM Links website. We're trying to make sure we get all of those materials uploaded for you by tomorrow. That website is healthbegins.org/CalAIM. And thank you all for joining, and feel more than free to send us any emails with any questions that you all may have. Thank you all so much.
Thank you.